Do you want to know what the major risk factors for glaucoma are? By the end of this video, you will know what glaucoma is, what the main risk factors for developing glaucoma are, which groups of people are at highest risk, and what you can do to protect your vision. Don't forget to subscribe to the channel and like this video. Let's begin. Glaucoma is a serious eye disease that damages the optic nerve, which is the cable that connects your eye to your brain and carries all the visual information you see. When the optic nerve becomes damaged, it leads to vision loss and can eventually cause complete blindness if left untreated. The scary part is that most people do not realize they have glaucoma until significant damage has already occurred, because the disease usually develops without any noticeable symptoms. Now, before we dive into the risk factors, it is important to understand one key measurement that doctors use when evaluating glaucoma. This measurement is called intraocular pressure. Intraocular pressure is simply the amount of fluid pressure inside your eye. Think of it like the air pressure inside a tire. Your eye is constantly producing and draining fluid, and the balance between production and drainage determines the pressure inside your eye. In most people, normal intraocular pressure falls between 10 and 21 millimeters of mercury. This is the unit doctors use to measure eye pressure. When the pressure becomes too high, it can damage the delicate optic nerve tissue and lead to glaucoma. However, interestingly, some people can develop glaucoma even with normal eye pressure, a condition called normal tension glaucoma. The first major risk factor is elevated intraocular pressure. Elevated intraocular pressure is the most important modifiable risk factor for glaucoma, meaning this is something that doctors can actually treat and manage. The higher your eye pressure, the greater your risk of developing glaucoma. For example, if your intraocular pressure reaches 30 millimeters of mercury, your risk of having glaucoma jumps to 25.4%. In comparison, if your pressure is below 15 millimeters of mercury, your risk drops to just 0.7%. This means having an intraocular pressure of 30 millimeters of mercury gives you about 39 times higher risk than having an intraocular pressure below 15 millimeters of mercury. This is why regular eye exams are so important to check your eye pressure. Age is another significant risk factor for glaucoma. The risk of developing glaucoma increases dramatically as you get older. Glaucoma is far more common in people over the age of 40, and the risk continues to increase with each passing year. One reason for this is that as we age, the optic nerve becomes less able to withstand stress from elevated eye pressure. Additionally, the drainage pathway in the eye that allows fluid to flow out gradually weakens over time. When this drainage pathway weakens, the eye pressure gradually begins to increase. Your family history is also a very important risk factor. If someone in your family has glaucoma, your own risk increases significantly. In fact, research shows that having a family history of glaucoma increases your risk by about 9 times compared to people without any family history. The risk is even higher if it is a sibling who has glaucoma rather than a more distant relative. Some studies suggest that more than 50% of glaucoma cases are actually hereditary, which means they run in families. This strong genetic component means that if your parents, siblings, or grandparents have glaucoma, you should be monitored closely by an eye doctor. Your ethnicity is an important factor to consider. African Americans have significantly higher rates of glaucoma compared to other populations. Research shows that glaucoma occurs about 5 times more often in African Americans, and blindness from glaucoma is about 6 times more common in this population. Furthermore, glaucoma tends to develop earlier in life in African Americans, typically about 10 years earlier than in other ethnic groups. African Americans should receive a thorough screening for glaucoma every 1 to 2 years after age 35 to catch the disease early. Myopia, also called nearsightedness, is another notable risk factor. The reason for this increased risk relates to the structure of the eye. Myopic eyes tend to be larger than average in size. This makes the optic nerve at the back of the eye more vulnerable to damage from pressure changes. Many people with myopia who develop glaucoma have what is called normal tension glaucoma, where the eye pressure is not particularly elevated, yet damage still occurs because the nerve is weaker. Now let's discuss some medical conditions that increase glaucoma risk. Diabetes is one of the most significant medical conditions linked to glaucoma development. People with diabetes are 48% more likely to develop open-angle glaucoma over a 20-year period compared to people without diabetes. The risk increases the longer you have had diabetes. The mechanism involves how diabetes damages blood vessels throughout the body. In the eye, this altered blood flow can reduce the nutrition and oxygen supply to the optic nerve, making it more vulnerable to damage. Hypertension, which is high blood pressure, is another medical condition that increases glaucoma risk. The reason is that elevated blood pressure increases the pressure in the blood vessels around the eye, which can affect eye pressure and reduce fluid drainage from the eye. Certain medications can also increase your risk of developing glaucoma. Corticosteroids are anti-inflammatory medications that are commonly prescribed for various conditions. About 18 to 36% of the general population will experience an increase in eye pressure when taking corticosteroids. However, this response is much more common in people who already have glaucoma, affecting 46 to 92% of those patients. Patients over 40 years old and people with diabetes or high myopia are even more vulnerable to corticosteroid-induced eye pressure elevation. This is why doctors carefully monitor patients taking these medications. Eye trauma or injury is another important risk factor. If you have experienced an injury to your eye from a blow to the head, blunt trauma, or penetrating injury, you have an increased risk of developing glaucoma. Corneal injuries and vitreal injuries, which involve the clear gel inside the eye, have been shown to significantly increase the risk of early glaucoma development. Some people develop glaucoma years after a traumatic eye injury, so ongoing monitoring is essential. Prolonged exposure to ultraviolet radiation from the sun is also a recognized risk factor for glaucoma. UV exposure can accelerate damage to the optic nerve tissue over time. This is why wearing sunglasses that block UV radiation when you are outside is a smart protective measure. Now let's look at some lifestyle factors that can influence glaucoma risk. Smoking significantly increases your risk of developing glaucoma. The chemicals in tobacco smoke can damage blood vessels and increase eye pressure over time. Excessive alcohol consumption is another lifestyle factor that can increase glaucoma risk. People who drink heavily have higher rates of glaucoma compared to moderate drinkers or non-drinkers. Maintaining a healthy lifestyle with regular exercise, not smoking, and limiting alcohol consumption can help protect your vision. Early detection is absolutely critical for glaucoma management. During an eye exam, your eye doctor can measure your intraocular pressure, examine your optic nerve, and perform visual field testing to check for signs of glaucoma. If you are diagnosed with glaucoma or are at high risk, treatment options include eye drops that reduce eye pressure, laser procedures, or in some cases, surgery. These treatments can slow or prevent further vision loss if started early. The key takeaway is that glaucoma is a serious disease that can steal your sight without warning. However, by understanding your risk factors and getting regular eye exams, you can catch glaucoma in its early stages when treatment is most effective. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and click on the next video.